Today's topic is chemotherapy of malignancy. So what is malignancy, or we can say cancer? So what is cancer and how does cancer differ from the normal human beings, or else how does the cancer cells differ from the normal cells? So if a person is affected with the cancer, normally a cell can divide, it can replicate and it can form new cells. But if a cell is infected with a cancer, or else we can say if a cell is suffering from cancer called as cancer cell and that divides, then it leads to a tumor. So what is tumor? These cancer cells, when they divide, they form into lump. They don't look like normal cells either in their function or nor in their structure. So if cancer cells divide and replicate, they form lumps and they finally form tumors. So these tumors are of two types. One is benign tumor and the other one is malignant tumor. So benign tumors are harmless tumors which are localized and they can be removed through surgery. But malignant tumors, they are easily spreadable and they can be only treated, but they cannot be cured. But nowadays researches have been made where cancer can be treated. So here the disease starts in the cell. So actually the disease will start in the cell, and if that cell replicates, then the cancer cells will spread all over the body. And the name of the cancer we usually call carcinoma, leukemia. All these names are given based on the cancer cells where they are formed. So the region where they are formed or the organ where they are formed in the body, the name of the cancer is done. Let us see the cell cycle. So how does the normal cell cycle, or how the cell division takes place? So here if we see, there are different stages in the cell division. Here this is the pictorial representation where we can see initially the cell cycle starts with G0 phase. We can also call it as gap 0. G stands for gap. And G1 phase, gap 1 phase, M stands for mitosis phase, G2 stands for gap 2 phase, as well as S stands for the synthesis phase. So what are all these phases? G0 phase is an inactive state where the cell does not divide at all. And if we see G1 phase, it is the time taken between the cell to divide and initiation of the DNA replication. So it is the time between the cell. The cell will divide, but DNA is not replicated. So the time taken between these processes, that is called G1 phase or gap 1 phase. And M phase is nothing but the mitosis phase, where there the actual division of the cell takes place, or the DNA replication will takes place. So here the DNA in this mitosis, there are 4 different stages: prophase, metaphase, anaphase and telophase. So the cell will undergo, or else the replication will undergo all these 4 stages, and finally the DNA replication is observed. And if we see the G2 phase, it is the time gap between the DNA synthesis as well as the process of undergoing mitosis. As well as S phase stands for synthesis phase, where the actual synthesis of DNA takes place. So initially the cell has to synthesize the DNA, and that DNA it replicates to form the new DNAs. Here we can see the pictorial representation of mitosis. Here there is G1 phase, that is interphase, and S phase where the DNA is synthesized, and mitosis phase, prophase. Prophase is initially where the spindle fibers are forming, and then here metaphase where the spindle fibers are fully formed, and anaphase where the division of the DNA is taking place with the help of spindle fibers. The spindle fibers will split, thereby the DNA is replicating, and in telophase where the another DNA is formed from the existing DNA. So by undergoing all these processes, the cell division takes place. So this cell cycle is same for even the cancer cells also. But if that cancer cell divides, and then it leads to tumors or cancer. What are the characteristic features of the normal cell? So how does the normal cell look like? So initially each and every cell have to undergo metabolism. So there are various components in the cell where the metabolism of the components takes place, thereby forming new products, new metabolites, or active metabolites or inactive metabolites. So active metabolites show their effect in the body, whereas inactive metabolites are excreted out of the body. And maturation and specialization. So the cell undergo replications, and thereby they form different cells. For example, if we take liver cells are called as hepatocytes, and the cells of the heart are called as cardiocytes. So even the cell names are given based on the location, or else based on the place where they are formed. So here the maturation and specialization of the cell is one of the characteristic features of the normal cells. And reproduction, the cells will replicate, forming new cells. And contact inhibition. So what is this contact inhibition? So here when the cell divides, it forms a new layer around it, forming a thick wall around the cell. So this contact inhibition is one of the characteristic feature of the normal cell, where it is not observed in the cancer cell. And recognition. So each and every cell has its own structure and own function where they are recognized. If we see hepatocytes don't have the same function of the cardiocytes, or cardiocytes won't have the same function of myocytes. So in the same way, these myocytes won't have the function of neurons, so which are the cells of the brain. So each and every cell has its own characteristic structure as well as function. What are the cancer cell characteristics? How does the cancer cell differ from the normal cell? So we can say it is unchecked and uncontrollable. So if a cancer cell is present in the body, it is not recognized in the initial stages. So it will take some time. The cell will replicate until and unless a tumor is formed. We can't recognize the cancer cells that easily, because in the initial stages they do look like normal cell only. Once they replicate and divide, then only we can recognize that it is a cancerous cell. And we can't stop the growth of cancer cell because they grow so rapidly, or they divide so rapidly, that they are uncontrollable. And the other one is loss of contact inhibition. So there will not be a contact inhibition in the cancer cells. So what happens? So contact inhibition, as I told you, a new layer is formed, making the cell thick. But because of this, what happens is that in the cancer cells, if the contact inhibition is not there, it bursts out. In some cases, it bursts out where the DNA is coming out, and the DNA replication is taking place, and new cells are forming very easily. So that is the reason this contact inhibition is absent in the cancer cells. And capacity to differentiate, they don't have the capacity to differentiate, so they can't differentiate between themselves only. If we see the normal cells are differentiated into different cells, like red blood cells, white blood cells, they can be differentiated, but cancer cells cannot be differentiated. So all cells are the same way. And increased growth fraction, they divide so rapidly, or they grow so rapidly that they are easily spreadable in the body. And chromosomal instability. So if we see in the human beings, we have 23 pairs of chromosomes in a cell. So these chromosomes are stable in a human being. They are not changed. But if we see in the cancer cell, the chromosomes of the cancer cell are unstable. They are not forming. For suppose in the cancer cell, the chromosome pair number is not 23 pairs. They may alter, or else there may be fluctuation in the number of chromosomes in the cancer cell. In capacity to metasize, so they can't undergo process of metasize. They don't have the capacity. And altered biochemical properties, so they don't have the same properties or same function of the normal cell. Here we can see the pictorial representation between the normal cell and the cancer cell. So here the cytoplasm, we see the cancer cells have less cytoplasm, and the nucleus. So here the nucleus is proper and it's having a proper shape and function. If we see the cancer cell, nucleus is not that proper. And nucleolus is also completely damaged, and the chromatin fibers which are present in the nucleus, they are also improper. If we see that normal cells have large cytoplasm and cancer cells have very less cytoplasm, and in the normal cells there is only single nucleus we can observe. But here in the cancer cells, we can see this nucleus is more. They are multinucleated cells, and there will be single nucleolus. Even the nucleolus which is present in the nucleus is also single, but in the cancer cells, there are number of, or else we can say multiple nucleoli are present. And here if we see the chromatin fibers, they have fine chromatin fibers, and here the chromatin fibers are coarse. Let us see the cell division in the normal cell as well as in the cancer cell. So here, as I told you, this is one of the metaphase. We can say this is the metaphase of normal cell. Here where the spindle fibers are formed and the DNA is united. The chromosomes are united. And here if we see in the cancer cells, they are lagging. The intact between the chromosomes of the cancer cell is lagging, whereby the proper replication is not taking place. In the sense, the growth is taking place, but the replication is not in a proper way. And if we see here, the multipolar mitosis. Usually the spindle fibers, they initiate from only one end, but here if we see the spindle fibers are existing, or else they are initiating from many ends. So here we can observe multipolar mitosis in the cancer cells. How this cancer cells can be prevented, or how the care can be taken if a patient is suffering from cancer. So there is a healthcare team who is taking care or observing the patient who is suffering from cancer. For example, a physician, oncologist, or a doctor. So a doctor who is specialized in cancer is called as an oncologist, and the patient is suffering from cancer, then definitely he has to consult an oncologist, where thereby he can be diagnosed from which type of cancer is suffering from. And then the patient and family counselors. So patient and family counselors, they should support themselves, that they do not be demotivated. If a person is suffering from cancer, we should not demotivate them, and we have to encourage them and make the person to live. So here the patient and family as well as the counselors should make up the mind of the patient to be happy. And the other one is nurses. If a cancer patient is admitted in the hospital, then the nurses who are taking care of them should take a proper, the patient should be observed in a proper manner. And the pharmacists who are prescribing the medication, they should give the proper medication, and they should not even give the medications which are contraindicated in the cancer patients. And dietitians. So cancer patients need a proper diet. So that dietitians have to prescribe a proper diet, or else give a proper diet to a cancer patient. And unit clerks who are working in the hospitals, the unit clerks should take care, and secretaries as well as voluntaries. So all this is a healthcare team. So all this team should unite together in order to make, or else we can say in order to survive for a cancer patient. So this team is essential, and they have to give even the moral support for the cancerous patient. What is chemotherapy? So chemotherapy is nothing but the treatment of the cancer with drugs. Chemo, chemical, the name itself indicates. Chemo means some chemical or drug where the patient is treated with. So drug therapy. So drug is given to a patient in order to treat cancer, and there are various number of drugs available in the market to cure cancer. So nowadays even the drugs are available in the market where even the cancer can be treated also. What are the goals of this chemotherapy? So why this chemotherapy is done to a patient? So first thing is that in order to eliminate the cancer. So that is the ultimate motive. So cancer cells have to be removed out of the body. So if not, they spread all over the body, even leading to the death of the patient in some cases. And shrink the tumor. So if a tumor is enlarged, or else if a tumor is in a big size, so the tumor cell have to be shrinked. Why? Because few tumors are removed through surgery. So if they are such a big enough, they can't be removed out of the body through surgery that easily. So that is the reason initially the tumor size will be shrinked, and thereby the shrinked tumor can be removed out of the body through surgery. The other one is prevent the cancer from spreading. So if the chemotherapy is given, then the cancer cell which is present in the body, it loses the ability to divide, thereby it is not spread that easily. And relieve symptoms from cancer such as pain. So the patient will be relieved from pain if he is given treatment. How the chemotherapy is given. So chemotherapy is given in various forms, like through infusion. So if drugs are available, they are given through IV route or through infusion form, where the IV bolus is injected to the patient, and through pills. So there are various tablets available in the market where this chemotherapy treatment is given, and the other one is infusion pumps. So these are also administered in order to give chemotherapy. And the objective of this chemotherapy is nothing but to destroy the malignant cells. So malignant cells are not removed through surgery, and they are even uncontrollable also. So in order to destroy and remove these malignant cells, this chemotherapy is given to the patient. Not only through IV route as well as pills and infusion pump, there are various other routes where this chemotherapy is given. For example, subcutaneous route, intramuscular route, intravesical route, topical preparations, intrapleural route, intra-arterial route, intrathecal route, intraperitoneal route, as well as intralesional route. So all these routes are given based on the region or based on the localized area where they are administered. What are the patient responses? If a patient is given chemotherapy, how the patient will respond to that? So there are four categories of patients. So if a person is suffering from cancer, if a group of people are there and if we are giving chemotherapy treatment for them, so all will not react in the same manner. So there are we can say four group of people, or we can say based on the response, these people can be divided into four groups, such as complete response. So if a patient is given with chemotherapy treatment, then he will be cured, or else we can say the patient will be recovered completely. And partial response. So if we administer chemotherapy drugs, then the patient will respond to that drugs only to some extent. So the disease is not cured completely or to the 100% mark. And stable disease. So here in this, if we either give laser treatment or if we give drugs or IV infusion, whatever it may be, the cancer is neither decreasing nor increasing. In the sense, the patient is not responding at all. The disease is in the stable manner. Either it's not increasing nor decreasing. So the cancer, or as we can say, the disease in the stable manner in these kind of people. And the other one is progressive disease. So what does this mean? So if we administer drugs, instead of showing the positive response, that is decrease in the disease, the person is having the increased cancerous symptoms. So here the disease is progressive. So here the patient response depends on the severity of the cancer as well as how frequently the patient is taking the chemotherapy. So if the patient is given first treatment and if he is not taking second treatment and coming for the treatment for after very long time, then the frequency of taking the treatment also alters the disease, severity of the disease. So, what is the chemotherapy, or as we can say, what are the drugs how does the chemotherapy is given into the cancer cells? One is cell cycle specific and the other one is cell cycle non-specific. So what does this mean? Cell cycle specific. We have discussed that cell cycle have different stages. So G0 to S phase or M phase. So here in the cell cycle specific, the drugs which are administered, they target one of the phase. For example, few of the drugs, they target the S phase where the synthesis of DNA is inhibited. The synthesis of DNA won't take place, then the cell won't replicate. And in few cases, the drugs are targeting M phase of the cell cycle where the mitosis is not taking place. So if mitosis won't take place, then the cell replication won't take place. So here in the cell cycle, one of the phase is targeted by the drugs where the inhibition of the replication of cancer cell is taking place. So here the most active, or else this phase which is most active, that is inhibited. And cell cycle non-specific. So cell cycle non-specific, G0 is one of the phase in the cell cycle, but it's not actually that active phase. So the cells which are in the G0 phase, that are in the inactive form. For example, in the G1 phase, cells are getting divided. The cells divide, but the DNA replication won't take place. So here in the G1 cells, the cells which are not divided, those will be undergoing G0 phase where they are in the inactive form. So few of the drugs, they act at the G0 phase of the cell. We cannot say that cell cycle exactly. They are non-specific. Cell cycle non-specific phase. So what are the chemotherapeutic agents which are used? So here if we see cell cycle specific, so most active phases are S phase and M phase of the cell cycle. So the drugs which drugs which inhibit the S phase and M phase, they are considered to be cell cycle specific chemotherapeutic agents, and these drugs are administered in the dosing routes. In the sense, they are dose dependent, as well as the administration of these drugs depend upon the formulation as well as the route of administration. Other one is cell cycle non-specific. So cell cycle non-specific are nothing but these drugs act in any phase, especially G0 phase, which is inactive form. So these drugs, or else we can say these drugs act on any one of the phase in the cell cycle, either S phase, G phase, G1 phase, G0, G2 as well as M phase. So they are not targeting only specific phase. So here we can say these are non-specific or else non-selective. Whereas if we see cell cycle selective are there where they are targeting only single phase in the cell cycle. So Combination. So what are these combinations? So here we are giving combination of two drugs where they are cell cycle specific as well as non-specific. So in this case, if one drug fails to show its effect, the other drug will show its effect. For example, if a cell specific drug is given and cell non-specific drug is given. So if cell specific fails, then this non-specific drug will show its action because it's acting on all the phases. So if one drug fails, the other drug will show its action in order to inhibit the cancerous cell growth, and this is administered in the repeated doses. So sometimes the drugs may have tolerance also, so that is the reason these drugs are given in the repeated doses. What are the factors affecting in order for a person to treat with chemotherapy? So what are the factors we have to make into consideration while treating a person with chemotherapy? One is the type of cancer which the patient is suffering from. So if a patient is suffering from the liver cancer or from some of the other cancer, brain cancer or breast cancer, so we have to identify which type of cancer the patient is suffering from, and then the treatment should be given. The other one is stage of the cancer. So whether the patient is having initial phase or medial phase, or the cancer is in the severe stage. Based on the severity and based on the stage of the cancer, the treatment should be given. The other one is patient's age. So age is one of the main factor where we have to consider. So few drugs, if we give in the later age, or we can say if they are given in geriatrics, then they won't function, or as we can say the patient cannot tolerate the dose as well as the power of that drug. So that is the reason age is one of the factor where the treatment, while we giving the treatment, it should be considered. The other one is general state of the health. So if a person is suffering from cancer, if he's suffering from only cancer or any other diseases he's having from, whether cardiovascular severity or renal failure or some CNS disorder. So all these have to be considered while giving the treatment. The other one is other health problems. So if there are any other health problems, as I told, so these have to be considered. The other one is types of anti-cancer treatments in the past. So if the person has already taken anti-cancer treatment, then why that treatment was not that effective? So whether there is problem in the medication or the frequency of the person taking, so previous history, medical history of the patient is taken into consideration while giving the treatment. Let us see the classification of few of the drugs. So as I told you, cell cycle specific, where only single phase in the cell cycle is inhibited, cell cycle non-specific. So we can see the drugs like anti-metabolites. So anti-metabolite drugs include 5-fluorouracil, methotrexate, folic acid, vinca alkaloids like vincristine and vinblastine. So these are naturally occurring plant alkaloids, indole alkaloids. The other one is cell cycle non-specific agents like alkylating agents like nitrogen mustards and busulfan, and anti-tumor antibodies, antibodies which are also called as antibiotics. So these are, this drug include bleomycin, and hormonal agents like tamoxifen. So these are few of the drugs which are used in the treatment of cancer. So what is chemotherapy, or how the chemotherapy can be given? So the chemotherapy can be given either in combination therapy or adjuvant therapy or neoadjuvant therapy. So what is this combination therapy? So the therapy, or as we can say, if we have to prescribe the medication either in combinations, in the sense not only single drug, but we saw different categories like anti-metabolites, alkylating agents, vinca alkaloids. So we have to give combination of these drugs. Or as we can say, if a person is already taking medication, then laser treatment is one of the additional therapy which is given to the patient in order to recover the patient from cancer very easily. So it prevents resistance. For example, if a person is taking one of the 5-fluorouracil drug, and he became tolerant and dependent for that drug, so that drug won't work against the cancer so easily. So in that condition, we have to give combinations. If combinations are given, then resistance of the drugs or resistance for the therapy can be prevented. The other one is adjuvant therapy. So adjuvant therapy is one of the therapy which is given as a primary therapy, in the sense it is administered after the primary therapy. For example, a surgery is done to a patient and tumor is removed. So after the removal of the surgery, or after the removal of the tumor and after the surgery, we can say after the primary therapy, then this adjuvant therapy is given in order to prevent the cancer cell from reoccurrence. So this is the adjuvant therapy. And neoadjuvant therapy, in the sense, it is given before the treatment. So given before surgery in order to reduce the tumor size. So as if the tumor is big, it's not removed through surgery. So in order to reduce the size of the tumor, then this neoadjuvant therapy is given in order to shrink the tumor and remove it out of the surgery. What may be the side effects of chemotherapy? So if we are giving drugs and we are giving pills, infusion pumps, we are giving the chemotherapy treatment through various routes. So what might be the possible side effects of these? So one thing is bone marrow suppression. So bone marrow is one of the place where the cells are generated. For example, the red blood cells and white blood cells are generated in the bone marrow, in the yellow bone marrow as well as red bone marrow. So if bone marrow suppression takes place, then the cell synthesis will be improper. And nausea and vomiting, but here all patients won't suffer from nausea and vomiting. Diarrhea, constipation, hair loss, fatigue, mouth sores. So because of the heat which is produced in the body, because of the antibiotics which are given and because of the drugs which are administered to the patient, so because of the heat which is produced in the body, then the mouth sores are observed. And here reproductive or hormonal changes, sensory changes, thinking and memory changes, as well as attention changes. So these are few of the possible side effects if a person is given chemotherapy treatment. Let us see how does all these side effects affect, or how can these side effects can be prevented. So first thing is bone marrow suppression. So as I told you, bone marrow is one of the site where the cells are synthesized. Like red blood cells which carry the oxygen. Red blood cells are one of the most important cells in the body which are present in the blood, as well as they carry the oxygen in the cells. White blood cells, these are the cells which fight against the infection. We can also call these cells as scavengers of the body. So if the foreign particle enters into the body, they will be in front like a policeman, and they invade the foreign cells and they throw out of the body. The other one is platelets. So these platelets or thrombocytes are one of the important cells where they aid in the coagulation mechanism, leading to the blood clot and preventing hemorrhage in the body. And these blood cells decrease, or else we can say if a patient is taking chemotherapy, then the cells count may be decreased, and thereby this is one of the possible side effects, that is the bone marrow suppression. Either the person may have thrombocytopenia, or else hemophilia, or else the various other mechanisms, the various other blood disorders if a person is taking chemotherapy. And this cells, or else we can say this side effect, we can it may be we can say this situation can be normal after the first treatment. So first initially the patient is given a treatment and the side effect is observed. Then with the second treatment, this situation can be normalized, but this is not observed in all patients. Low red blood cells. So if the RBC are one of the important cells which carry the oxygen, they supply the oxygen all over the body. So if these red blood cells are lowered, then the lowering of the red blood cells is only for shorter period of time. So chemotherapy is given and only for short period of time the red blood cell count will be reduced. But if this situation persists for longer period of time, then it may lead to anemic conditions. Here we can see if the severity of the red blood cell count is increased, then the anemia can be observed. So what are the signs and symptoms of anemia? So we can see there will be yellowing of the eyes. So if a person is suffering from anemia, then the eyes will be yellowed, and the skin as the red blood cells are not present, the skin will be pale, yellow in color, as well as we can see the cold sensation in the patient. There will be shortness of breath, the person won't breathe properly. Muscular disorders, the person will be fatigued. And then the stool color, so in the excretion, the stool color will be changed. And in the central nervous system, we can see the person will be having dizziness, fatigue or tiredness and fainting. And in the blood vessels, if we see there will be very low blood pressure, heart functioning will not be proper, and in the severe cases it may lead to heart attack also. And in the spleen there will be enlargement of the spleen. So these are all the possible effects or symptoms which can be observed if a patient is suffering from anemia. White blood cells. So as I told you, these white blood cells are policemen or as scavengers in the body. So here they are the first line of defense. So here if these cells also, the count can be reduced only to a shorter period of time after the chemotherapy. And once the chemotherapy is done, I mean, the situation can be normalized after the second treatment. If the white blood cells are lowered, then the immune system becomes weak, or else we can say the person will have the inability to fight against infection. So there are various red blood cells like lymphocytes, monocytes, eosinophils, basophils, neutrophils, etc. So all these cells will be damaged, and thereby the person can't fight against the infection. What are the signs and symptoms of infection? So if white blood cells are not functioning properly, then obviously the patient will be suffering from infection. So what are the signs and symptoms which we can observe if patient is suffering from infection? So one thing is like flu-like symptoms. So person will suffer from cold and difficulty in breathing and cough-like symptoms. The other one is feeling warm, chilled or shaky. So here, depending upon the patient's body, either the patient will have warm body conditions as well as the patient, in few patients the body will be in chilled condition or cold condition, and sore throat or mouth. So there will be mouth sore, the mouth sores will be formed. And the other one is productive cough. So there will be dry cough and the patient will have discomfort while coughing. The other one is fever. The temperature may rise up to maximum. And then burning when urination or urinating. So while the person is passing the urine, then there will be burning sensation. The other one is area of redness or tenderness. So in few areas we can find redness or itchy like rashes can be observed, and loose or liquid stools, we can say diarrheal condition. How we have to prevent this? How the infection can be prevented? So one thing, we have to keep ourselves hygiene. So before we use the toilets and after we use the toilets, then definitely we should wash our hands. And even if we touch any dust particles or if we are exposed to pollutants, then definitely we have to wash ourselves, the washing of hands, and we have to avoid the people who are suffering from infection. So we should not completely boycott them, but if we have to avoid them, or we should take care while the infection patient is present in front of us, and then check with the oncologist check with the oncologist before having any invasive procedures. So before actually going into the invasive procedures like surgeries and all, we have to consider oncologist whether this infection can be treated with drugs or not. And then they avoid skin cuts and wounds. So if a skin cut or wound is there, then definitely we have to cover it. If they are uncovered, then the pollutants or infection causing microorganisms can enter through that wounds and sores, and thereby they invade our body. The other one is low platelet count. So the platelets or thrombocytes are one of the important cells where they cause blood clot. So coagulation procedure is taking place with the help of these blood clots only, and they are preventing from hemorrhage. So if a person is having excessive blood loss, then in order to prevent this excessive blood loss, these platelets will help, or they aid in the clotting of the blood. So if a platelet count is reduced, then the person will have the inability to clot, or else the blood will have the inability to clot in that particular patient. What are the signs and symptoms if a person is having a low platelet count? So one thing is that the cut won't stop bleeding. So if there is any cut, then the bleeding, or else the blood oozes very rapidly, or else we can say the blood oozes for a long period of time and the clot won't be formed. And bruises on the body, so there will be minor bruises in the body where the blood will be oozing out, and bleeding from the nose and gums. So we can observe nose and gum bleeding, and red pinpoint rashes. We can see in the diagram there, they are pinpoint red color rashes are there. That's not blood actually, but it's a kind of rash, and black tarry stools, and then blood in the urine. The other one side effect is fatigue. So the person becomes weak. So this is one of the most common side effect of the chemotherapy patient. So each and every person will undergo this side effect, that is fatigue. So once the chemotherapy treatment is given, then definitely the person will become weak. So what are the signs and symptoms? So energy will be low, and they always feel sleepy, and they won't be that active also. They won't participate actively, and they always like to sleep and be alone. Nausea and vomiting. As I told you, all the patients won't have this side effect. So only this nausea and vomiting like sensation can be observed only in few patients who are not taking, and because of the taste of the drugs, or else because of the drug action in the body, then this nausea and vomiting can be seen as a side effect in only fewer patients. The other one is constipation. So constipation is caused because of some chemotherapeutic drugs. So a few drugs have the side effect of constipation. So one of the side effect of these chemotherapy drugs is constipation, and some anti-nausea drugs. So if a person is having the feeling of, or else we can say if a person is having the side effect of nausea and vomiting, in order to prevent that person from this condition, the anti-nausea drugs or anti-emetic drugs are given. So these anti-emetic or anti-nausea drugs have the side effect of constipation. And the most pain medication, so the NSAIDs, that is non-steroidal anti-inflammatory drugs or analgesics, if they are given to relieve pain in the chemotherapy treating patients, then these drugs also have the side effect of constipation. And reduce the fluid or fiber intake. So if a person is not taking fluid properly and fiber properly, fiber is one of the most ingredient which allow the movement of particles in the intestine or abdominal cavity smoothly. So if fiber is not taken properly, then that leads to constipation. The other one is stress and lack of exercise. Diarrhea. So diarrhea is nothing but this stool, liquid or watery stools, and this diarrhea, if it is untreated, then the person, it leads to severe conditions, like there will be dehydration, there will be lot of fluid loss in the body. So what are the causes? So chemotherapy drugs, few chemotherapy drugs have constipation as side effect, and few chemotherapy drugs have diarrhea as side effect. The antibiotics and bowel surgery, if there is any bowel surgery, then also it leads to diarrhea. And radiation to the pelvis. So in the pelvic region, if the radiation is given, then also this diarrhea can be observed. And one is dehydration. So if excessive diarrhea or if excessive vomitings are observed, then definitely the dehydration occurs in the body. So if a person is definitely taking chemotherapy treatment, then the person should take fluid intake, or else the person should consume a lot of water in order to prevent this dehydration. So if this dehydration, if it's untreated, then it may sometimes lead to death of the patient also. So what are the signs and symptoms? So first thing is that the person becomes weak, person becomes pale, thin, and sometimes there will be nauseating sensation. The person will have extreme thirst. So if we drink water also, then the thirst won't be, we can say, stopped. So there will be excessive thirst. The person will have dry mouth, and the urine output is also reduced, and dark colored urine. We can say the concentrated urine is passed out. How it can be prevented? So we have to at least take 8 to 10 glasses. So based on our body weight, for every 20 kg of body weight, 1 liter of water have to be consumed. For example, if a person is 60 kg of weight, then the person should consume close to 3 to 4 liters of water in order to prevent dehydration condition. So this is one of the, and use anti-diarrheal medication. So if a person is having diarrhea, in that condition anti-diarrheals are preferred in order to prevent the diarrhea and the excessive fluid loss out of the body. And when feel better, eat the foods which are in high calories. So if we take high calorie food, then definitely they aid in the prevention of dehydration. The other one is mouth sores. So mouth sores, these are, like we can say, they are not observed in all patients. They occur within few days after the treatment. So these, mostly 90% of the patients will have this mouth sores, and in that, this mouth sores, they are observed initially after few days of the treatment. So after a few days, for example, we can say after 15 to 20 days of the treatment. So these days may differ from person to person. So few persons will have these mouth sores within 10 days or 15 days, or few persons may have after 1 month. So depending upon the patient condition, these mouth sores can be observed, and these mouth sores are usually observed on the gums, on the tongue, as well as in the oral cavity, where there will be difficulty in swallowing for the patient. Here we can see the sign and symptoms. There will be pain in the oral cavity, and there will be bleeding gums. So the gums which are present in the oral cavity, there will always be bleeding gums, and thereby there will be difficulty in swallowing of the patient also. And because of this, that may spread, and that can lead to the oral infection. What are the skin changes? So if we are giving laser treatment, so chemotherapy also includes laser treatment. So if a person is taking laser treatment, if he is exposed to laser light, so then it may have side effects like there will be the redness of the skin. So skin is, we can say skin is the first line defense in the body. So if the foreign body is entering, say if the foreign body is entering, the skin will stay as the first line defense. So if the organism or the foreign particle, if it crosses the skin and come, then we have white blood cells. So if they also cross and come, then immune cells. So there are various levels of defense mechanisms in the body. So the skin is one of the first line defense. So if this skin is given laser treatment, then it may lead to redness, there will be itching sensation, there will be rashes, as well as there will be sometimes dryness of the skin. So because of the dryness, there will be scales observed on the skin. If the scales are there, then the skin is peeled off very easily. In most of the patients, this is one of the common side effect, that is hair loss. So hair loss is observed as a side effect because of the few of the chemotherapeutic drugs used, and the other one is this hair loss can be observed within 2 to 3 weeks after the treatment. So if a person is taking, after the first treatment is given and within 2 to 3 weeks, this hair loss can be observed. And then if the hair loss is there, so if a person is having hair loss, then the scalp is very tender, we can say the scalp is very soft. So in that condition, the hair growth won't be in a proper manner, or else we can say in few patients the hair growth is almost impossible. Another one is we can say suggest not to cut. So after the treatment, once the treatment is given, we should not suggest the person to have a haircut. Why? Because there will be hair loss, and after the haircut is given, then there will be synergistic effect of hair loss. So that is the reason the hair loss cut or haircut, the haircut can be has to be not recommended for a patient who is taking the chemotherapy treatment. And but once the in most of the patients, or we can say 95% of the patients, the hair loss can be prevented and hair growth can be observed after the final treatment. So once the final treatment is given and after 1 to 2 months of the final treatment, then the hair growth can be observed. In the body, we have 5 different senses. So here the touch, sound, taste, smell as well as sight can be altered if a person is taking chemotherapy treatment. And what are the taste changes which we can observe? So because of the drugs or because of the treatment which is given in the cancer patients, the taste of the drugs can be altered, or else we can say the drugs cannot taste that good. They may sometimes have metallic taste, or else we can say the cardboard taste that can be observed in the patients. So in that condition, the patient can't take food properly, and because of that there will be fluctuations in the appetite. So the person's or the patient's appetite can be altered because of the metallic taste or cardboard like taste. And the other one is, in these conditions, in the drugs we have to use some sweetening agents and flavoring agents in order to make the in order to make the formulation sweeter, or else the formulation can be tasty and thereby the person can take it easily. What are the memory changes? So the person, if you're taking chemotherapy treatment, then the person may have the concentration of the patient or the focus of the patient can be altered. The patient cannot focus or cannot have proper memory, and sometimes the person, we can say chemo brain or brain fog. So what does this mean? The person's ability to think and memorize the things can be lowered. So the person cannot have proper thinking, as well as the memory of the person can be lowered because of the treatment in the cancer. The other one is this: there will be difficulty in thinking and focusing, and in some conditions they may even have fatigue, stress as well as insomnia, that is sleeplessness. The other side effect is that reproductive hormonal changes. So the hormones like testosterone, progesterone, estrogen, as well as the reproductive hormones which are present in the body can be altered. So because of the hormonal levels which are altered in the body, sometimes it may affect the fertility, or as we can say it may sometimes lead to infertility. And the other one is it may lead to early menopause in women, and it may lead to the sexual desire can be altered or changed in the patients who are taking chemotherapy treatment.